Hi, my name is Phil Pavlinch. I'm a pharmacist with Equitas Health.
And my name's Drew, and I'm a student pharmacist with Equitas Health.
And we will be conducting a Naloxone training video today. In 2014, there were 2,744 deaths from opioid overdoses reported in Ohio. This is an 18.3% increase from the previous year. Due to these alarming statistics, Ohio Bill 4 was signed into law in 2015, allowing pharmacies to dispense naloxone, the antidote for opioid overdose, to an individual without a prescription from a doctor. This individual may be the drug user themselves, or it could be anyone who may come in contact with someone at risk for an opioid overdose, such as a family member or a peace officer. Examples of some opioids are oxycodone, hydrocodone, heroin, fentanyl, morphine, and methadone. In this video, we will cover risk factors for an overdose and how to effectively recognize and respond to an overdose. First, it is important to understand the risk factors for an opioid overdose. Technically, anyone using an opioid of any nature is at risk for an overdose. There are a couple of things that can increase that risk. Opioids should not be mixed with other drugs such as benzodiazepines like Klonopin, Valium, or Xanax, or other depressants such as alcohol. The more often someone uses a drug, the higher the dose they might require to achieve the same effect. This process is called tolerance. Another risk factor is not understanding tolerance. When someone takes a break from using, or a drug holiday, their body loses their ability to process that much drug at one time. If they begin using opioids again, they should start out at a lower dose than what they used before the holiday. Another risk factor is coexisting conditions like asthma or COPD. Because opioids slow your breathing, these conditions put an individual at a higher risk for an opioid overdose. Individuals with an impaired ability to eliminate drugs, such as kidney or liver issues, are also at an increased risk for overdose. This is due to the fact that the drugs will accumulate faster in the body. Lastly, a person with a previous overdose is at an increased risk of experiencing an overdose in the future. Some people will have experienced or witnessed an overdose, while others may have not. It is important that everyone knows how to recognize when someone is overdosing. An overdose can take minutes to hours to occur. Someone who is experiencing an overdose will have some of the following signs: slowed breathing, coupled with a slow, erratic, or no pulse, vomiting, pale and clammy face, blue lips or fingertips, snoring or gurgling noises, and no response when you try to yell their name or wake them up. One method of checking response is to rub your knuckles hard against the middle of their chest, also known as a sternum rub, as this will wake someone up unless they are experiencing an overdose. It is important to check the person's mouth to see if they might have choked on something. Next, we will go over how to respond when you suspect an opioid overdose. It is important to call 911 immediately, even if naloxone is administered. The naloxone lasts less than 20 minutes in some cases. Therefore, a person can go back into overdose after it has been administered and should receive medical care. First, you want to try to wake them up. If they do not respond, check to see if they are breathing. If they are breathing, even if the breathing is irregular, administer the naloxone immediately. If the person is not breathing, a single rescue breath can be given if the rescuer feels comfortable doing so. When administering a rescue breath, first lay the person on their back, tilt their head back, lift their chin, and pinch their nose shut. Make a seal between your mouth and theirs, and gently breathe out until you notice the chest rise. It is important not to overinflate the person's lungs, as this can do more harm than good. Once you've administered the breath, administer the naloxone immediately. Now we will go over how to assemble the naloxone nasal mist. First, you remove the 2 yellow caps from the delivery syringe. Then, you will screw on the white cone to the top of the delivery syringe. Then, you will remove the purple cap from the naloxone barrel. Then gently screw the vial of naloxone into the barrel of the syringe until you feel a slight resistance. Finally, you will insert the white cone into the nostril and give a short, strong push on the end of the vial to spray into the nose. You should spray about half the dose, or 1 ml, into one nostril, then switch nostrils to deliver the other half of the dose. If there is no reaction in 3 minutes, assemble and give a second dose. Note, if all of the first dose was given in one nostril, spray the second dose in the other nostril. Now we will walk through using the Narcan nasal spray. There is less assembly associated with this product, so it is easier to use and the directions are on the box. First, remove the product from the package. There is no cap to remove. Insert the tip into the nostril before depressing the plunger to deliver the entire dose into the same nostril. Again, if there is no reaction in 3 minutes, deliver a second dose. Now we will walk you through how to use the EVZIO intramuscular injection.
If you are ready to use, pull off red safety guard. To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1. Injection complete.
Now, let's go over some frequently asked questions and myths about naloxone.
If naloxone reverses the effects of opioids, why would I want to call 911?
An overdose is a medical emergency that requires additional medical attention and monitoring. Naloxone is temporary. Opiates can remain in the body much longer than naloxone.
How often can I get naloxone?
Most insurance will pay for 2 doses of naloxone every 30 days, but ask a pharmacy staff member to get an exact answer.
Are there any side effects from using too much Narcan or using it on someone who isn't experiencing an opioid overdose?
Actually, there are no side effects from using too much Narcan or from using it on someone who isn't experiencing an overdose. The only effects they may experience are withdrawal symptoms, but that's the intent of the drug, to get someone out of overdose. Do not let this stop you from using Narcan on someone.
What if it doesn't work right away?
If naloxone doesn't work right away, or after 3 minutes, use another dose.
Is it safe to use a cold shower or an ice pack to shock someone awake?
Actually, when someone's in overdose, their blood pressure is already really low. Using an ice pack or a cold shower will further drop their blood pressure, potentially causing internal organ damage. However, a safe alternative is the sternum rub, or you could rub underneath the person's nose if you don't have access to their chest. Again, it is very important to call 911 as soon as an overdose is recognized. If you have any further questions or want to learn more about resources for addiction, talk to one of our pharmacists or check out prescribetoprevent.org.